Welcome to our first lecture. I'm going to just begin real basic with a nice kind of fundamental background on what you have taken in probably quite a few classes: anatomy and physiology, phys of X, if you've taken a biology class, a variety of classes you've gone over basic heart function. So again, as I mentioned, this class, we're going to slowly pluck through every week a different concept. By the time we get to the end in April, I know all of you are going to be shocked at how much you understand about the electrical current of the heart. And when we say, let's run a stress test, you're going to feel a lot more confident than just looking at a bunch of these lines that you don't know what's going on. So anyways, again, you have access to these slides on Brightspace. So basic heart and function, we are going to go over a few of the learning objectives. So my goal is you can understand what we call neural factors that influence cardiac function. What are they? The basic electrical conduction system, which will be the theme for many weeks, is how that conduction goes down the heart, the flow of the electrical impulse, different states of polarization, how oxygen and nutrients are delivered to the organs and also to the muscle tissue, and then how the waste products in reverse. So it's kind of a not really a lot of stuff. So this is your classic red and blue photo that's showing you the deoxygenated blood that is received. It's received through the veins, the deoxygenated blood, and transported all the way through the heart's right side. So on the right side, right, this is where it's going to go, and it's going to come in here and get oxygen, and then it's going to go back out through the pulmonary system to go into what we call systemic circulation. So through that pulmonary artery, it's getting shipped out into our systemic, our body, for the organs. So we have two types of circulations. We have what we call peripheral circulation, right? So over here we've got the peripheral, and then we've got pulmonary circulation. We will go over the different chambers, the atrium and the ventricles, and how all of these valves are controlling the blood flow that goes through the heart. So the heart itself is up here in our thoracic cavity, and we've got this nice thick sternum and the set of ribs that protect it for a reason. So the format of the bony structure of our thorax helps to protect that heart that's lying right inside of our chest. So anterior to the thorax, we have our vertebrae. On the border, we've got our lateral to the lungs, and it's obviously tilted a little bit at an angle. So, down towards the right, the left side of your heart, it's mirrored image here while I'm talking to you. 2/3 of the heart is situated on the left side of the sternum. So we will talk about the sternum a lot, right? The sternum is that really thick, hard bone here. And the base of the heart is superior. Portion of the heart is what we know receives all that blood flow, so receives the great vessels. The apex, which is the very, very bottom of the heart, lies up against the diaphragm of our chest. The heart has many different walls, one of being the pericardium, right? So the pericardium is a fibrous sac. It kind of reminds me of maybe like a pillowcase, right? It's going to enclose the heart itself. It anchors the heart to inside the chest wall, so it keeps everything protected, and it's got multiple layers of protection, double membrane. The outside of the outer membrane is and the inner membrane, again, these double-walled protections help to make sure that when we're running, if we're running around, if we have any type of impact, there's many different layers of protection, so our heart, the muscle itself, isn't going to get bruised. So, which it still can, which is kind of like the brain, right? The concussion, but it's really protected. There's a lot of fluid, so it's not going to sustain injury as easily. The outermost layer is called the epicardium, and the epicardium, right? So we've got all of these different layers. We've got the myocardium, we've got the endocardium. These different cardiums, so epi, myo, and endo, all are really important because of the cells in which they are comprised of. Really, we speak a lot about the myocardium when someone is having a myocardial infarction, right? The muscle, the myocardium. But we also have different illnesses that can happen for the endocardium and the epicardium. So we're not going to get too much into diseases in this class, but we also know, again, these different layers our cardiac cells function differently than our skeletal cells. So these cardiac cells that really have a really important role in how they maintain contractility of the heart. So cardiac cells and skeletal cells, right, muscle fibers, you know those as, they do behave differently. And we're going to talk about how the contraction happens and how they contract to sustain our life, to make sure that electrical the conductivity is going through to the heart. This is a kind of a very popular and classic photo in any textbook, right? So we already saw the red and the blue earlier with the peripheral circulatory system and right, the pulmonary circulatory system. Now this is showing you what those cavities look like. So we have the largest artery in the heart being the aorta, right? So the aortic arch goes up across the top. And we've got inferior and superior vena cava, right? So these bottom are shooting down to the lower and bringing back up from the lower, and then our top superior is, again, either pushing it out to the systemic or bringing it back in. Then inside, we have all of these different chambers. So we have the right atrium, we have a valve that goes into the right ventricle. Valves are really important, and we'll look at valves when we take a look at some different irregular rhythms, because if the heart's not pumping in a nice coordinated fashion, so if it's letting too much blood flow in or not enough blood flow in, a lot of times somebody's cardiac output is going to be compromised. They could end up going into an irregular rhythm. So valves must open and close in a really coordinated set of times. So we've got the atrium, the tricuspid valve, the right ventricle, and then we've got that septum that divides, that wall that's going to divide. These are all papillary muscles in here that are holding, because the valves have a lot of high pressure fluid going through them. So those papillary muscles are really important to hold that valve in place. And then over here we've got our left atrium going down to our left ventricle. The left ventricle is very thick. You see the muscular wall because that's got to pump enough blood to get out into the circulation. So the force of the contraction, the contractility, really serves a different purpose than what's happening over here on the right side. So very nice cross-sectional view. I'll use a lot of this language as we move through the class, and you'll be somewhat familiar with it. So again, the 4 chambers and 4 sets of valves. So the atrium, like I said, it's going to receive the blood from the pulmonary and the systemic circulation, and then it's going to deliver the atrium down to the ventricles. The ventricles are going to pump the blood into the pulmonary and systemic circulation, and then we've got the inarterial and intraventricular septums. Those septums help to make sure the blood's not moving side by side. Valves. Okay, this is the important thing about valves, and a lot of you just need to make a note and kind of understand this. We have things called the AV valves. We have 2 AV valves, right? Atrial ventricular valves. We have the tricuspid valve. The tricuspid valve is the right atrium to the right ventricle, and we have the bicuspid, which is more commonly every day known as the mitral valve. And the mitral valve is separating the left atrium from the left ventricle. So those are what we call AV valves, atrium, ventricle. So the tricuspid's on one side, the mitral's on the other. AV valves, right? The atrium and the ventricle. Then we have 2 semilunar valves. The semilunar valves are either the pulmonary or the aortic. So the pulmonary valve is the right ventricle going to the pulmonary artery, and the aortic valve is the left ventricle going out to the aorta. So what are the AV valves? What are the semilunar valves? How does blood flow, right? So coronary blood supply. So during diastole, that's the word we use for relaxation. So during diastole, the right coronary, the marginal, and what we call the PIV, posterior intraventricular, the blood supply is going to go to the inferior aspect of both those ventricles, right? The left anterior descending, which is that really big artery that falls right down the front of that heart, it's supplying to the front, the anterior aspects of both those ventricles. So the whole front of the wall, the whole front of that heart, right and left side, is what we know as the LAD. So when we look a lot at heart disease, we often find compromised LADs that have, plaque in there, and they, down that very front wall. The LCX is a circumflex. It's the artery that wraps around kind of laterally, kind of to the back. So the left circumflex supplies the lateral aspect, of both the left ventricle and the atrium. What I'm telling you are your main coronaries. So if somebody has heart disease, these are the coronaries that are commonly blocked, occluded, have atherosclerosis or plaque buildup. Depending on the percentage of the plaque, depends on what type of damage we have to the blood flow going into the heart. These coronaries lie superficial. Okay, so let me just go back. So when you think about the cross-sectional view, this is where the blood is inside the heart, right? This is the flow of blood moving, right? That's the chambers that it's being held in. When we are looking at the actual coronaries that we see with heart disease, the circumflex, the right coronary, the left coronary, the LAD, that's what we're looking at. And this is a nice photo of showing you, without it being cross-sectional, right? They lie on the top. So if we take a look at these large red lines, and that is what, right? So the left anterior descending, the LAD. This is the LAD. It starts up here and it goes all the way down. I didn't mean to click that, right? That's the LAD. This is the circumflex that wraps around the back, right? Over here we have the right coronary. So these are important when we take a look at someone's angiogram and understanding where those coronary arteries lie. Let's get into a little bit of the physiology. So the neural factors affecting the heart. The neural factors, you know this, and you've learned this at some point. I know you've all learned this, the autonomic nervous system. So the autonomic nervous system is what's going to control for speed up or slow down, right? So it can do two things, right? Speed up, slow down. So when you're taking a look at the autonomic nervous system, we want to take a look at what is controlling increasing, right? So automaticity, excitability, conductivity, contractility. So we have two ways it can be innervated, through the sympathetic or through the parasympathetic, right? So speed up, slow down. Sympathetic is going to stimulate, right? That's what you know. At one point you learned this as the fight or flight response, right? You get anxious, you get scared, someone alerts you, right? Stress happens. You can feel your heart increasing, right? Those are the neural effects of the autonomic nervous system. The sympathetic has gone up. The parasympathetic is what helps to slow things down, right? So it's not having to overwork. So you might know this as the tortoise and the hare, a very common way that many biology professors, anatomy, physiology professors. So when you're thinking about speeding up, right, the sympathetic, increase heart rate, increase contractility, what's happening is the AV node, we haven't talked about it yet, but this is the AV node here in the middle. This AV node is going to be the main chemical messenger that's going to send epinephrine, right? So it's going to really increase the epinephrine, and what's going to happen? The heart rate's going to go up. The opposite happens over here with the tortoise. Parasympathetic slows things down. So heart rate goes down, contractility goes down. Again, the AV node senses what's going on and it slows things down using acetylcholine. So when you think about what are those neural factors that are affecting the autonomic nervous system, parasympathetic, sympathetic, epinephrine, right, versus acetylcholine. What is happening to the heart rate? What's happening to how fast someone's heart rate is going? This slide is something that I will use this language a lot as we, fast forward a few weeks, we get into some of the EKG stuff. So what I'm looking at on this slide is what is the nodes? What the nodes are, what you want to think about, kind of the electrical current that's running through the heart. So before I say these, I want to just show you the photo. So before I tell you what these are, we have these chambers that hold the blood, and within there, as I showed you before, we have this kind of like a wire, right? It's kind of like, the walls behind you have, wiring that goes to the electrical outlet. That's what we have. We have this kind of wiring system. We call it conduction. So we're going to talk about these nodes, right? The sinus node, the AV node, down the Purkinje fibers. So when we talk about nodes in these next few slides, I want you to envision this photo. So, when we are thinking about what is the main pacemaker of the heart, it's really the SA node, right? That SA node is up high in the left atrium. Sorry, the right atrium. I said that backwards. So up high sits your SA node, right? That's the top. The SA node is what we call the pacemaker, and it should be healthy enough to send the conduction all the way through the heart. And then we sit here and we grab our pulse right now, and all of you are kind of falling asleep and your heart rate's beating nice and slow. That's the SA node that's helping to send that pulse down. From the SA node, it goes into the middle. We call that the AV node. The AV node is going to sense the AV from the SA node. The AV node is going to sense it. There's a slight delay, and then it's going to divide into those His bundle, right? The bundle of His that goes down the septum and divides into the right and left ventricle. Bundle of His can speed up the impulse. Each one of these bullets, the SA, the AV node, and bundle of His, have an appearance on the actual EKG. So we will in time look at what happens when the conduction is moving at a fast rate, a slow rate, it's delayed, there's a block, a conduction block. And believe it or not, this is all going to make sense in time, but we want to look at what is a healthy SA node, what's the AV node look like, what does the bundle of His look like. After the His bundle of His, we have these little branches, right? You've seen those little branches, bundle branches. You might have heard of something called a bundle branch block. We'll take a look at what that looks like in time, right? That's all so His bundle to the bundle branches, and then we have all the little Purkinje fibers. This conduction system helps our heart to contract, so we call that depolarization. So we really have an action potential that's going to begin and send that impulse so the ventricles contract. So when we talk about polarization of the heart, right, that 5 phases of what happens with the action potential. First stage is polarized, resting state, no activity, right? Negative resting membrane potential. Then it gets depolarized, right? So the 5 phases of the action potential. Depolarization happens. Repolarization goes back to resting state again. So what does this really look like? So we have these phases. I'm going to jump to the photo because I think sometimes this helps us first, right? So when you think about, this is called the Weir's diagram, often called the cardiac output, right? Which you have a lot. You're like, what in the heck is she showing me? This is a lot on this photo, but this is what I'm trying to help explain, that in one heartbeat, right, your heartbeat beats one time, you're having all of these changes of pressure, flow, valves opening and closing. Okay, so when you take a look at the phases of the action potential, how this happens, right, I'm going to go back to these phases. We have these kind of numeric phases. Resting phase is ready for the stimulus. Then rapid depolarization happens. The cells receive an impulse. It depolarizes, contracts, and then we end up sending that repolarization gets sent, early repolarization all the way down through the conduction system, and the cells are activated, and what happens is we end up at the end of this having, blood flow coming out of the left ventricle. So from depolarization, and then it goes all the way back, it revisits rapid repolarization, which is that nice resting polarized state to happen all over again. So when you look at the states of polarization, there's a refractory period, which we will look at on the EKG. It's pretty absolute. There's no stimulus, nothing is going on, right? Absolute. Then we have the relative that happens a little later in the phase called repolarization, that if there's enough happening and significant stimulus is received, we can see things happen. I'm not going to test you on the phases of an action potential. I want, as we maybe get to maybe week 5 or 6, for it to make sense when we take a look at an EKG as to why those lines look different. It's because what's happening in through the SA node all the way down to his Purkinje fibers, right? That electrical conduction system. So the actual up here in the top of the heart, in that right atrium, we have what we know as the pacemaker, right? The pacemaker of the heart, I always say, is kind of like your electrical box in the basement of your house, right? You've got all those wires going into that main box, right? It used to be fuses, now it's flips, right? That's kind of the main circuit. So that's what the SA node serves. The SA node serves to send this tempo so we can send that current down, and if it's healthy bodies, it's all going to do what we're all doing sitting here right now, having this nice regular sinus rhythm happening. Fast forward a couple of months and we start looking at irregular rhythms. Now we usually have a conduction problem caused by an issue. Goes back to the autonomic nervous system. We can look at autonomic neuropathy. We can look at diabetes and blood and hypertension, all these things that can trigger the neural factors from inhibiting our conduction system to be doing what it should be doing. The Wiggers diagram is what I showed you earlier. It's very confusing. It's many textbooks will call it just a cardiac cycle, one cardiac cycle. So it's a coordination of the heart structure, function, blood flow, and electrical conduction system. It's everything you've ever learned thrown into one diagram. What I want you to know by the end of this semester is understanding the P, Q, R, S, and T waves, right? The electrical cardiogram and cardiorespiratory function and phys of X and all these other classes. We will look a little bit more at blood flow. So this is kind of the one and all photo, right? So what I'm most concerned of for this class is here's our P wave, our QRS, our T. Then look at this, right? There's some, it just kind of pauses, right? This is a diastole, and then it all repeats again. So we have one heartbeat here. You would feel that on your pulse, right? So that QRS, that's a beat on your pulse, and then it goes through, and then we have another one. So we've got two heartbeats here. When you look up this diagram, you see the flow of the ventricle, what's controlling ventricular flow, the valves. So where in the heck am I going to find the valves on here, right? So the valves need to open and close. So you see this first, second, and third. These are valves opening and closing to control the pressure, the aortic pressure, right? So how do I know the valves are opening and closing, right? Have your eyes jump up. Mitral valve closes, aortic valve opens, right? All of these valves need to open and close at just the right amount of time for us to have what you and I are going to learn as what is a normal EKG. This is a lot on day one, but I want you to realize this class is focusing on you understanding the electrocardiogram. The rest is some little things you've caught here and there in other classes and how it all comes together. So basic cardiac function, structure of the heart, autonomic nervous system, and then definitely, we'll talk a lot about the conduction system. This is going to make sense. We're going to come back to this a lot. All I want you to do this week, right? Nice, easy beginning, kind of weasing our way back into spring semester, is I've got two different discussion posts. One is tell me about yourself, and I know it's kind of cheesy and always silly to do that, but given the fact that we're never going to be sitting together in a class, this is 100% online, I want us to all get to know. I will do a discussion post too. You can ask me questions. And then we're going to talk about exercises medicine. Some of you already know a little bit about it. Others, not much about it, but that's going to be my next lecture. I want you on your own, I want you to go to the EIM website, and I want you to find something on there that you think is something you might actually use, a tool, a handout, and I want you to find something interesting that you find interesting, post the link to the discussion thread, and we're all going to talk about it. So we're going to have who are you discussion, we're going to have find something cool, interesting on the EIM website that you might use in your practice, in your internship, in your life, with a family member, for yourself, any of that good stuff. So that kind of covers my first chat. Again, you know how to contact me. I can answer any questions, no big homework, just nice, easy beginning to our class together.